Do you want to know what is needed to perform PRP injections in your lab? Here's your checklist. First, you need the appropriate diagnosis to perform a PRP injection. Then you'll need to gather the appropriate supplies for the injection, such as sterile gloves, lidocaine, an 18-gauge 1.5-inch needle to draw up the lidocaine, a 25-gauge 1.5-inch needle to administer lidocaine, a 10cc syringe, a sterile probe cover, sterile gel, a sterile machine cover, sterile gauze, chloraprep, a fenestrated drape, and a bandage. Also need supplies specific to PRP, like a 30 and 60 milliliter disposable procedure pack. That will include venipuncture supplies, an anticoagulant, a container called a process disposable that has a white and red port, and the appropriate syringes and needles needed for the blood draw and the PRP prep. One must include a spacer for the syringe. You'll also need a centrifuge on site to spin the patient's blood. This will separate the platelet-rich plasma from the whole blood. Inside the centrifuge, you'll need a 30 and 60 balance weight so that you can remove the one that you're not using and replace it with the process disposable container while the blood is spinning. You also want to make sure that you prepare the patient for the out-of-pocket expense because insurance typically does not cover PRP injections. After you've explained the procedure, along with the cost, the risks, and the benefits associated with it, you'll want to have the patient sign a consent form before you start the procedure. You also want to ensure that the patient has been informed that they cannot take anti-inflammatory medications such as NSAIDs for 7 days prior to the procedure and for 14 days after the procedure. As far as personnel goes, you want to make sure you have a trained physician available to administer the PRP injection and perform tendon fenestration if needed. You also want to have an assistant, such as a sonographer, to help set up and guide the procedure. And you also need a nurse or a phlebotomist available to draw up the patient's blood on the day of the procedure so that you can prepare the PRP. You also want to make sure you have post-procedure instructions for the patient to hand to them after the procedure is complete so that they feel confident knowing what to expect. Once you've checked all these boxes, you're ready for PRP application. Thanks for watching. Don't forget to like, share, and subscribe to my YouTube channel.